Welcome to SVG-TV News for Thursday, February 25th, 2021. I am Rochelle Batiste with the details. St. Vincent and the Grenadines has recorded 2 more COVID-19 deaths, bringing the total to 8. This was announced today by Chief Medical Officer Dr. Simone Kisa Beach at a news conference hosted by the Ministry of Health, Wellness and the Environment.
60-year-old female of Sandy Bay who died at home on February the 8th. The female, who was known to be COVID positive, complained of abdominal pain and died. This week, we received confirmation from the consultant pathologist that this death should be ruled as a COVID-19 death, even though we were not able to do a postmortem. The second death occurred today, a 43-year-old male who was admitted to the Milton Cater Memorial Hospital on February the 10th with symptoms in keeping with COVID-19 and was confirmed to be COVID-19 positive after admission. The patient with a history of hypertension became progressively ill and was placed on a ventilator earlier this week. However, sadly, the patient died this morning at 9:40 a.m. Additionally, I would like to refer to 2 persons who died in the last few weeks who were COVID positive. However, their deaths were not related to COVID-19. Our deepest sympathies are extended to the families and friends of these mentioned citizens.
Providing a situational report on the number of COVID-19 cases in the country and their distribution, Statistical Officer in the Ministry of Health, Maxine Glasgow-Cottle, said up to the time of the news conference, no new COVID-19 case was recorded. On Wednesday evening, however, 7 new cases were recorded. Cottle said to date, 1,526 COVID-19 cases have been recorded in SVG, with 615 active cases.
The demographics remain relatively unchanged. The majority of the cases are in the 25 to 44-year age group. The majority of the cases are in the Kingston, Calico, and Pembroke health districts. Most of the cases are women, 55.8%, compared to men, 41.8%. Despite the uptick on the 21st, this rate is trending downwards. Notice that from February 14 to the 20th, the positivity rate was below 5%, and on the 23rd, the rate was again below the 5% threshold.
Senior Nursing Officer in the Community Nursing Service, Sister Julie Russell, is encouraging Vincentians to take the AstraZeneca COVID-19 vaccine. About 2 weeks ago, SVG received 5,000 doses of the AstraZeneca vaccine, including the booster from Dominica, which are expected to be administered to 2,500 Vincentians. Sister Russell said the vaccines are being administered to health workers, police officers, teachers, persons 65 years and over, and those with underlying conditions such as diabetes and hypertension, and their families. The senior nursing officer used the opportunity at today's news conference to explain the vaccination process.
It's very simple. Persons can make their appointment, go to the vaccine site. So any of the vaccine sites, you can go there and you can make an appointment. Also, there is an SVG health page on Facebook. There is a Google form there that persons can fill out and submit. After filling out and submitting this Google form that you will find on Facebook, on our Facebook page, a staff at one of the vaccine sites will call you to tell you your time, your date, and where you should go and receive this vaccine. What we are doing, though, is letting the nation, our people, go to a vaccine site that is closest to them.
Sister Russell said it is advised that persons with food allergies and other allergic reactions not to take the vaccine. She also noted that persons with uncontrolled and very high blood pressure, 180/110, will not be vaccinated.
Before administering the vaccine, the healthcare provider will check persons' vital signs. We will check your temperature, your pulse, your respiration, your blood pressure. Now, for some persons, we know that as soon as they notice that nurse have this blood pressure machine, they can then develop a fright that will send the pressure up. Or it might be a hypertensive sitting in front of us whose blood pressure is not controlled. So after doing the reading, we realize that it is a high reading. As normal, like going to see the doctor or going to get your blood pressure checked, we will leave you to relax a while, try and reassure you and all of that. And we check the blood pressure. Now, if after we checking the blood pressure, the reading is a reading higher than 180/110, we don't give that vaccine. We refer you to a doctor. Now, if it is lower than that, we give the vaccine. We also ask if you have any allergic reaction to anything, whether medication, food, or whatsoever.
The senior nursing officer further explained that, like other medications, persons can have adverse reaction to the vaccines. Hence, those who take the jab are usually asked to rest for 20 to 30 minutes at the health center where it was administered.
And we also reassure persons. Now, persons will come to us because they want to get this COVID-19 vaccine. But when they get to us, they have this fear. They have questions that they still need to be answered, even though they are saying they want the vaccine. So in this case, we are willing, and yes, we reassure these persons. Now, after receiving the vaccine, we allow persons to rest for 20 to 30 minutes so that we can look for any adverse reaction. Like any medication, you can get an adverse reaction. Normally in St. Vincent and the Grenadines, we have a form that if there is an adverse reaction, that we will fill it out, and COVID is no exception.
Sister Russell is asking families with shut-ins who are interested to take the COVID-19 vaccine to contact their healthcare center, and a team will come to their homes to administer the vaccine. And Chief Lab Technologist Elliot Samuel said there is hope in beating COVID-19 with the vaccines now available. Debunking some of the myths about the COVID-19 vaccines at the news conference today, Samuel said persons are often afraid to take the jab because they were misinformed or they are concerned about the safety of the vaccines.
Has to do with the timeline. When compared to the timelines I just described, the COVID-19 vaccine was produced rather speedily. And this speed has fueled a lot of skepticism. Now, we understand your concern. However, that development didn't really take place in just 10 months. It didn't just take them 10 months to create these vaccines. Work began on coronaviruses actually as far back as 2003, when the world experienced the SARS outbreak. And it continued when there was the MERS outbreak a few years later. By the time we began experiencing SARS-CoV-2 outbreak in December of 2019, there was a wealth of research data to build on. Couple that with the fact that there was global collaboration and a wealth of funds was then thrown into research and development, it really isn't surprising that we got the vaccine in such a short space of time.
Samuel used his personal experience of being vaccinated with the AstraZeneca Covishield vaccine to answer 2 questions which he said are commonly being asked. Are the vaccines tolerated by the human body, and will the vaccines protect you from COVID-19?
Now, most people who get vaccinated will experience a mild side effect within 24 hours. And I've had my vaccine, and I can attest to this, that you are going to feel some discomfort within the first 24 hours of receiving the vaccine. Now, the discomfort is going to vary. There's pain around the injection sites, swelling around the injection site. There's a general feeling of tiredness. The headache comes on. You have fever, chills, body pains. In terms of my personal experience, it was about 12 hours after I took the vaccine. I started with the fever first, and that progressed into chills, what we call ague. By the morning, I had the headaches and the generalized body pain, but by 24 hours after vaccination, it all disappeared, and I was back to a state of normalcy. I couldn't go to work the day after I took the vaccine because I wasn't really up to it. Physically, I wasn't up to it.
And in reference to the national vaccination program, which was rolled out almost 2 weeks ago, Statistical Officer in the Ministry of Health, Maxine Glasgow-Cottle, said 1,330 vaccines have been administered to persons across St. Vincent and the Grenadines. 1,325 persons received their first dose, while 5 other persons received their second dose.
150 are healthcare workers, which is 11.3% of the total number of persons vaccinated. Healthcare workers include doctors, nurses, laboratory technicians, and attendants, just to name a few. When we consider the health districts, 381 vaccines were administered in the Calico Health District. This is 28.65% of the total. 302 in the Kingston Health District, 22.71%. 206 were administered in the Northern Grenadines District, which is 15.49%, followed by the Marico Health District with 178 vaccines, which is 13.38%.
Some updated information now on the Lasso Freire volcano. The National Emergency Management Organization, NEMO, said a camera set up at the volcano was replaced. On Monday, lead scientist Dr. Thomas Christopher told SVGTV News that the camera monitoring the new dome was damaged by the acidity of the gases. NEMO said there are plans in place to install a new seismic station at Bamboo Range on the eastern windward side of the volcano, and that equipment for installation is being prepared by the Seismic Research Center and the SOFRE monitoring unit team. It was further noted that some maintenance work was done on the equipment installed at NEMO, and this station is now fully operational. NEMO said its staff will be conducting a drive-through in the Rosebank community this Friday, February 26, to update residents on the state of the volcano and to provide them with information on evacuation procedures and individual preparedness. The Disaster Emergency Management Organization is reminding the public that no evacuation order or notice has been issued, and it continues to appeal to the public to desist from visiting the volcano, especially going into the crater, since doing so is extremely dangerous. NEMO said it will continue to provide regular updates on all activities taking place at Lasso Freire. National Heroes and Heritage Month will be observed for the second time during a pandemic, and organizers say though some of the activities will be scaled down, they will continue to showcase SVG's heritage and culture during the month. This year's theme for National Heroes and Heritage Month, observed annually in the month of March, is appreciating our identity, preserving our heritage with pride. Cultural Officer in the Ministry of Culture, Maxine Brown, said that on March 14, National Heroes Day, the wreath laying ceremony at Dorsetshire Hill will be held, but in compliance with health protocols.
This will be held at the Obelisk in Dorsetshire Hill on Sunday, March 14th at 8 a.m. One of the main objectives of this particular program is to commemorate the Right Excellent Paramount Chief, the late Joseph Chatouillet, while we simultaneously try to preserve our national heritage. And how can we do this possibly? We teach and showcase, we pause to remember, and that's important. We spend time with each other, we celebrate our people, and of course our cuisine. In our preparations for the wreath laying ceremony at the Obelisk, and that's quite right next to SVG-TV station, we are still finalizing the performers, including the speakers, as we strategize creative means to incorporate the arts while maintaining the full protocol that pertain, as laid down by the Ministry of Health.
Several communities have cancelled their events, including those in Fancy and Rose Hall. However, Brown said that there will be virtual events and a drive-through event in Fancy.
For this month, some of the communities and organizations in which we collaborate will not be engaging in the usual activities for the reason we all know. These activities allow large crowds to gather, and during this period, that cannot be entertained. Again, I reiterate, we want to maintain the protocols. Having said that, the team at Fancy has confirmed that they have cancelled the activities. But Greg is still in the process of finalizing what can be possibly done during this period, this COVID period. In fact, one of the activities they're thinking about is a drive-through to pick up eats on March 14th, that's Sunday, March 14th. So it's like a meals on wheels, so to speak. That's the approach they're taking on. The Garfield Heritage Foundation will resort to the virtual spare in delivering its activities. Also, the Rose Hall Cultural and Development Organization will engage in virtual cultural programs as well.
The cultural officer said that while the activities will be scaled down this year, she is encouraging all Vincentians to embrace their culture and heritage, noting that there are many ways of doing so while being at home.
Simply by spending a bit of time with our elders, and these include people, our relatives, our elders, our grandparents. Our food during this time too plays an important role, as we bring out the traditional dishes and recipes from bam bam or the cassava bread, the dukona, the madongo, ferine, blackfish, breadfruit and saltfish, or our stew, chicken back, our caldo soup, and of course, other tasty things. Actually, it's probably one of the easiest and most fun way to preserve our heritage. By cooking, we grew up eating all these fancy foods that is passed down from generation to generation. It is indeed wonderful for our children to learn more about our heritage. After all, it's quite a delicious treat for all of us.
To facilitate the partial reopening of schools for students with hands-on school-based assessments, a number of protocols have been implemented, which students and teachers are expected to strictly adhere to. In a series of telephone interviews, SVG-TV News spoke with a selection of principals and vice principals at several schools in the Kingston area on the measures they have put in place to safeguard their students and teachers.
Our students are coming in smaller groups, so they come and they are only about 8 at a time, 8 maximum in any class setting. They are requested to wear their masks. They are requested to sanitize when they come on compound. And then we do have our thermometers to do temperature checks.
So we have the hand washing stations up as usual and the sanitizers, and we sanitize the rooms that they would have to use before they came back. They have to wear masks and keep the distance. You can't have more than 10 in a room. That's the protocol put in place, and the students have to regularly wash their hands and keep distance. That is a little bit difficult because children will be children.
At the gate, for example, we have our hand sanitization going on right there as soon as you enter the premise. You go to your class, we have temperature checks. During the day, we make sure that the students use a lot of hand sanitizer in between classes. When teacher changes and so on, we have people cleaning the classroom during the day, not just lunchtime and so on. We have people coming in like break time to clean, so all the desks will be wiped and so on.
With some parents calling for the full reopening of schools, the authority figures at some of the institutions our news team interviewed express a common sentiment that now is not the time for the entire student population to return to school.
Prior to the reopening of schools, there were discussions on the format for reopening, and you had a mixture of face-to-face and blended learning, keeping the protocols in place in terms of spacing so that you don't have all of the students on the compound all of the time.
I think it's still too early to open because there are too many children in school. We have 430 students and we really can't maintain that protocol. The blended approach would be difficult to do because our teachers are teaching upper and lower schools, so we will have to juggle them around. But I mean, it can be done, but I'm just saying it will be difficult to have that approach. But I think it's probably a little bit too early now to bring them all back together for this too.
The social distancing is a problem, and we know that in schools, definitely, once a child has a cold, it spreads. Simple as that. And their children, they just would mingle. I guess what the authorities would need to do is to come up with a plan of how to reopen schools in terms of what levels. Want to bring in one group, but maybe not all.
The St. Vincent and the Grenadines Community College will introduce a new program in teachers' education for the upcoming 2021-2022 academic year. The college will now offer a fully online program in early childhood care and development set to commence August 2021. The college says the one-year certificate program is geared towards preschool teachers who have an interest in receiving formal teacher training but may find it difficult to pursue full-time studies. Now an opportunity is being presented to those individuals, which offers more convenience and flexibility. The college will also experience another first in the upcoming 2021-2022 academic year, as the institution will introduce a fully online program in primary teacher education. This will be the first time the college is offering this program exclusively online. Continuing its adjustment to the new normal, the college will offer a blended learning experience to students enrolling in its 2021 Early Childhood Education full-time program. Dean of Teacher Education at the college, Dr. Harriet De Silva, in encouraging prospective students to apply, reiterated that teacher training is required if teachers wish to unlock the true potential of students in the classroom. The college will host a webinar informational session via Zoom on Tuesday, March 2nd, 2021 at 6 p.m. detailing the 2021 programs offered through its Division of Teacher Education. The admissions period for entry into the 2021 Teacher Education programs is Wednesday, March 3rd, 2021 to Friday, April 30th, 2021. Interested persons are asked to apply through the college website or to contact the college for further information.